Hi folks, and welcome to A&P with Dr. O. We're going to go ahead and use the synthetic cadaver now to discuss the cardiovascular system. We are going to focus on the heart and some of our major systemic and pulmonary vessels. And to do this, we need to look in the thoracic cavity. I'm going to go ahead and move these abdominal and pectoral muscles to the side. And now we can see the thoracic cavity. Here we have the sternum. Here we have the ribs. And then if we open up this thoracic cavity, we can see the pleural cavities, which house the lungs. But again, our focus is going to be on the pericardial cavity, which is going to house the heart. Let's go ahead and take a look at the major systemic vessels. If we look at the systemic veins first, here we can see the superior vena cava, and then our first branches are going to be the brachiocephalic veins. So this would be the right brachiocephalic vein, and then over here we would have the left brachiocephalic vein. If we follow that brachiocephalic vein, eventually it turns into the subclavian vein, which we have here. And then we also have these branches, which are the jugular veins. So we have our external jugular vein, and then we have our internal jugular vein right here. If I push those veins to the side, then we can see our systemic arteries. Our major artery coming from the heart is the aorta. We have the ascending aorta, and then we're going to have the aortic arch. And if I move the heart to a little bit, we can see that aortic arch right here. And then after that, we have the descending aorta. To remember the branches of the aorta, I like to use the ABCs. First, again, would be that aorta. And then we would have the brachiocephalic trunk, which would then give rise to the common carotid arteries. So we've got the right common carotid here, and then we would have the left common carotid over here. So that would be our C. So ABCs, our S then is if we move all the way over, this would be our left subclavian. So aorta, brachiocephalic trunk, common carotids, and then we would have our subclavian. If we look at the pulmonary vessels, here we have the pulmonary trunk, which is going to give rise to the pulmonary arteries, which we can see here. And then if I turn the heart over a bit, then we can more easily see the pulmonary veins. And then if we go back to systemic circulation, we saw the superior vena cava here. And now that I have the heart turned over, we can better see the inferior vena cava.